Okay, so I got into a Facebook argument with a right-wing acquaintance from my school days about healthcare. I was eager to deflect my Majority Report knowledge. I said he eventually came back with, my issue with the ACA is that it focuses too much on how to pay health insurance costs and not enough on addressing why health insurance costs are so insane to begin with, i.e. administrative costs, regulatory costs, tort litigation, and insurance companies as a barrier between provider and provided. And no, I did not believe the best solution is to have the government step in and say, hey, this is how much everything costs. Don't like it? Tough. This is something Republicans always come back with. I know you've talked about these issues before, but I can't remember what episode. If it's clipped, I need a little help. Single payer would be able to address administrative costs and break down the barrier of insurance companies between patients and providers and things. Am I crazy to think it would? Look, the bottom line is that the administrative costs of Medicare are about 20 percentage points less. Administrative costs for Medicare are about 3 cents on the dollar versus 25 cents on private insurance. But more importantly, the issue is that our healthcare is too expensive. And our healthcare is too expensive because doctors, hospitals, medical device makers, drug companies are using it, generate massive profits because there's no way to, and really basically over profit on something that is should be provided for every American. And the only way to constrain those costs are to have a single payer that says, we're not paying for it. There are other ways. I would have patent reform in terms of drug prices. But to allow the government, even under Medicare, to negotiate with, to use the power of being basically a monopsony, to use the power of being the single buyer to drive down costs, to say, hey, you know what? An MRI or whatever it is that you are prescribing because you happen to own the device is not called for in this situation. And how do we know this? Because we have data that we've compiled over the population of 300 million in this country that suggests that an MRI is not called for in this situation. So we're not going to cover it. So you've got to work out with your patient that you want to pay, and you've got to justify why they're going to pay for that MRI. So I don't know how else to explain that, but yes, it's true. The ACA oversold the affordability part and undersold the patient protection parts. But a single payer is really the only system that you can have that's going to control costs. I guess you could also say, like, we're just going to cap doctors' fees, distinct of insurance. So insurance companies can pay whatever they, but we're going to cap doctors' fees. You could have that. But the idea that a Republican is saying, or a conservative is saying, that the government's not doing enough to control costs, that there is no program. Tort litigation, go look at Texas. Tort litigation is not the cause of why health insurance is so expensive in this country. And it's not health insurance. It's health care that's expensive. That's the problem. Health insurance reflects how much it costs, health care costs in this country. There's some waste there, but it's not, fundamentally, that's not the big thing. It's still expensive for Medicare. But it's just that the government pays. Hi, folks. Sam Seder here. We still need your help on our Patreon page. YouTube ads have come back, but not nearly as much as we had before. So if you can help us out, any little bit helps. Head over to our Patreon page right at this URL, and you'll help us keep helping you by making videos